classified as a probable case and treated as such. And the other point I would make, just a reminder about the Marist cluster, when the school was closed, all staff and students were treated as close contacts and isolated as such. Final point on that one, and for all our clusters, is I've asked my staff to talk to the Medical Officer of Health who's overseeing each cluster to get a sense of where they are at, and to use testing to help ring fence those clusters, and that may include testing people with no symptoms to check and see if they are pre-symptomatic without symptoms. So we are going to widen the use of testing to help us make sure we are ring fencing all the clusters.
How would you determine which people you test who don't have symptoms?
So people who are close contacts of extant cases and who we think might be at high risk, especially because they're in a domestic situation, then we will start to use testing even if they don't have symptoms to check and see if they are pre-symptomatic.
Kaikohe is a good example, and of course the school in Dunedin. In those cases where we had a staff member in the supermarket up north, every supermarket worker was tested regardless of whether they were symptomatic or asymptomatic, so that's an example of where that's been used. The Director General and I were talking a little bit about clusters, cluster management and cluster protocols before this press conference, and we thought what might be useful is tomorrow we'll spend a bit of time talking through the way clusters are managed by regional public health and share a little bit more detail around some of what happens on the ground when a cluster is identified.
What's the government's current stance on antibody testing kits?
Yes, thank you. So antibody testing kits are still under development. We're watching very closely because the advantage of antibody testing is that you don't need to do it in a laboratory. It can be a finger prick type test. It's not as accurate, but it can have a particular role in identifying, for example, where someone might be a close contact and they may have infection, and you can do it rapidly and get a result quite quickly, and also may play a role as part of our ongoing surveillance, where we're using it, not a diagnostic PCR test, but to check and see what sort of levels of infection there may have been in a group historically.
Follow-up question. Yep.
Sorry, just on the healthcare workers that you mentioned at the start, how confident are you that they haven't spread COVID-19 to their workplaces?
Well, what I can say is that whenever someone has symptoms and is then self-isolated and tested, there is that, especially in a healthcare setting, very, very robust identification of close contacts, both other staff members and or potentially people who were using the facilities. So the public health units are very, very rigorous in that setting to make sure that any close contacts are stood down. And you will have seen a couple of instances already, one at North Shore Hospital and one at Grey Base Hospital, where staff members were stood down immediately because they were close contacts.
Several Instagram influencers in New Zealand, Instagram influencers in New Zealand are saying that 5G is the cause of COVID-19 and kind of peeling that conspiracy theory. Do you have a message to them and to New Zealand?
Just simply that is not true. And I can't state it clearly enough. And I almost hesitate to even speak to it on this platform. It is just not true.
Prime Minister Dr. Bloomfield gave the stats for testing by ethnicity.
Yes.
Māori are 13.6%. That's below the total Māori population, which is over 16%.
Yes.
What is the government doing to keep encouraging Māori to test?
Yes, what I think Dr. Bloomfield will come back with, though, is, for instance, some extra analysis around the rate of positivity within that testing, because my recollection from the numbers yesterday were that we had roughly 90 or so positive tests there. So looking at it from that angle is also helpful. But here would be my message. Of course, we have been telling people to stay at home. But if you are unwell, if you are symptomatic, if you've got a temperature, a dry cough, please call Healthline or call your local GP, your iwi health provider, and do reach out for a test. We do want to make sure that we are reaching everyone in our community who may be affected by COVID-19. And here's another really important message. There is no stigma to that. Do not feel that if you're feeling symptomatic that there's any shame in having COVID-19 or experiencing it. We need to know and we need to help, and so don't feel any of that or any hesitance in reaching out.
So if the numbers for Māori testing go down or the Māori confirmed cases go up, will you consider adding money to the Māori targeted funding, the 57 million?
I think actually the way we should be dealing with that is through the surveillance testing, because that will then demonstrate to us where we have not only population groups that are either potentially being under-tested, but there's no sign of that yet, or regions that are. And I think in that regionalised breakdown, that will then focus on where we need to increase that level of testing and proactively go into communities. But Dr. Bloomfield on that?
Yes, so I think the additional funding, particularly for Māori health providers, is both to support getting the messages out and ensuring access for Māori to get tested, but also to support them to continue to provide the full range of services that Māori need to deal with existing health needs. I did do used to be called back of the envelope, now it's front of the cell phone, quick calculation of the positivity rates, and we want to firm those up, but they are between 1 and 2% for Māori and Pacific, which is good. In fact, a lower positivity rate means that we are testing a lot to identify those cases.
Yeah.
Around the Latin Māori perspective, when it's come to the government's response for COVID-19, I mean, what's your response to that, and what sort of representation do you have at your high-level core government expert panel when it comes to Māori?
Can you give me any specifics? Because I'd be really happy to respond to that, but I just wouldn't mind some.
Call on e-tangata at the moment. I have tweeted it, but I can share the link. But I mean, there's criticism around there, and also
Forgive me, I'm not on Twitter.
The Bloomfield around tangihanga and the need for that to be looked at again. I mean, could you provide some sort of response to those concerns, please?
Yes, sure, and the advice around tangihanga has been led very much by our team within them, and our Māori Health team, and John Whanga, who's the Deputy Director General, and have discussed it with Māori communities, with iwi leaders and so on, but it's definitely something that should be under constant review.
Otherwise, to answer your question, I'd say that we've been particularly mindful of tailoring our public health response specifically for Māori and Pacific communities. And that is why very early on we ring-fenced within the 500 million we put aside for our COVID-19 response specific Māori health packages and Pacifica packages. And that is because we've been really aware that taking a generic and uniform approach wasn't always going to work for all of our communities in New Zealand that particularly we need to focus on, and who might be more vulnerable than others. And so we have relied on the expertise of others for that.
Just following on from that, the National Iwi's Chair Forum wants police to enforce the lockdown with military support in those remote areas. As they say, police don't have the resources. How vulnerable are those remote areas?
Again, if there are specific examples of where there's been concern that the police haven't followed up on issues, or they feel that police aren't resourced because, again, the Defence Force have always been available for any needs to be met, but the police have consistently given reassurance that they did feel they have the resources to meet any issues. So again, if I had specific examples, we did on one occasion have one raised, but actually found that there was actually no need for concern in that region.
Right. Have
you checked with all your ministers and all your MPs if they've breached the lockdown rules?
No, I haven't, because the lockdown rules are for everyone, and it's implicit in the same way that I don't start every cabinet meeting asking everyone whether they've complied with the cabinet manual. I expect it of them.
Yep. On testing of close contacts, a doctor has been in touch with her and said a man displaying clear symptoms of COVID-19 was tested, but his wife was refused a test. Should she have been refused a test?
If she was not symptomatic, then even under the current case definition, we wouldn't routinely test her. And that's been the case under previous and is the case under the current case definition. We test symptomatic people, and we may use testing in the case of, for example, specific settings like in a healthcare setting, or to help with cluster management.
Ask a couple of questions on behalf of other colleagues.
The loss of sense of smell has been added to the case definition, but it's only if they're also presenting an acute respiratory infection. Should, given that it's an early sign of the virus, should it be broadened that if they only present that loss of smell, they should still be tested?
I think there's still not enough information to know just quite what the significance is of the loss of smell. I'm pleased, and I think it's good that it's been added as one of the cluster of symptoms, but in and of itself, it's not as significant enough or sensitive enough to be a sign for testing.
Yeah, down the back.
Why is New Zealand not participating?
I'll just go come down the back.
Numerous people have told Newsroom that they've had to wait 5, 6, 7 days, sometimes even longer, to get the results of their COVID-19 test, and this is after lockdown has started. Is this the norm? Why is it happening?
So I've had a couple of reports, including via the Prime Minister, of quite long waits for testing results to GPs and then on to people. What I can say is this: if the test result is positive, the person is contacted immediately by the public health unit and the appropriate actions taken. It has been taken, it sounds like, in some instances too long for the negative result to get back, but what I can do is assure both practitioners and people waiting for results that if the test result is positive, they will be notified immediately.
How long are you seeking to get these results? In an ideal world, would a positive result be reported from when the swab is taken to when the report comes to the individual?
So the aim is to process all the swabs within a 24-hour period and then report the results from there, and then everybody should be notified within the next 24 hours. And of course our aim would be, and where I've had specific examples, including one this morning, I've contacted the DHB Chief Executive to follow up on how they could get the results out just as quickly to the GPs to make sure they can notify patients, because people will be waiting and they will be anxious while they wait.
Yeah, that is one of the things that, of course, that was raised with me when I raised a specific case, just to get to the bottom of some of this, is that, of course, the people often raising these issues are the person who's had the test done. It might not necessarily, the test hasn't been processed, it's that information hasn't been passed on always necessarily through the chain, ending with the GP itself. So that's something that obviously we're acutely aware of, and now working to make sure that that information reaches people, even if the processing has already been done.
Would you consider
I'll come here and then back to Toba. Yeah.
When can businesses expect to receive guidelines about how they might expect to operate under a level 3? They say that's crucial for them.
Yeah, and look, one message that I can share now is with every business, whether or not you're operating at an essential area, or even if you're operating in some of those areas where it is more difficult in a COVID environment, such as hospitality, what I'd ask you to do is prepare. Our new normal is going to be an environment where we need everyone to be able to help us with contact tracing. So if you think about your business having now basically new health and safety needs. So think about every person coming through the door. If you need to, would you be able to find every person that came through the door on any given day? Would you be able to look at who's had contact with different parts of your supply chain? This is the kind of information and preparation we need businesses to do because it will be critical. Equally for your workforce, what measures have you got in place so that people can use appropriate social distancing? And have you looked at the PPE guidelines for your area of work and think about what protective equipment may or may not be needed in your line of work? Businesses can do that now and would really encourage them to do that.
All businesses to be able to operate under level 3?
No. Not under level 3. You'll see that there are some specific caveats. We will keep providing guidance and we're working up, based on our level 4 experience, some really thorough guidance around our expectations at level 3. But again, regardless of which field you operate in as a business, you can think now about social distancing and contact tracing.
Time frame on when they can expect that guidance?
It is in train as we speak. The alert levels, of course, already contain broad parameters, but we're digging into that in more detail.
May I ask one of Dr. Bloomfield and one of you asked afterwards, Prime Minister, from my colleagues. Dr. Bloomfield, the amended case definition, you talked about broadening testing for clusters. Is the case definition broad enough for community testing in general, broader community testing in general, and would you look to widening that criteria?
So the case definition isn't designed to support or identify when we should do community testing. Any community testing would be part of broader surveillance, and you might use different approaches. For example, one of the approaches being used, I know, in Israel is they swab a group of people, but instead of testing each swab individually, they will run a batch of 50 swabs through one test and only then go back and retest if they get a positive result from that. And that way you can not use up so much of your laboratory capacity but still do wider testing. That would be more part of our ongoing surveillance to support our efforts to keep stamping it out as we go into levels 3 and then down to 2.
Yeah, I think it's fair to say as well, as Dr. Bloomfield's already said, that when you're doing cluster management, you don't necessarily apply the case definition in such a strict way as well. You had another question?
Yes, please. Will the Warriors be granted an exemption if the NRL competition were to restart in Australia, and are is the government in conversations with them?
Unfortunately, I cannot answer that question for you. I would be happy to make sure that the Minister for Sport does, though. Prime, did you have any others from other...
Are you aware of lab workers still planning to strike through to May?
No, but I do know on the previous potential strike action, we had confirmation that that would not affect our COVID-19 lab processing. But
yes, and that particular negotiation has now been settled.
Prime Minister, a Washington Post headline this morning read, "New Zealand isn't just flattening the curve, it's squashing it." Would that be an would that be a right characterisation of where New Zealand's at?
Well, of course, our focus has been stamping it out. And so they've chosen to use a particular descriptor, but I think what I would say is that none of us are working or focused on trying to create a model for anyone other than ourselves. We are trying to do what is right for New Zealand, for New Zealand's population, for New Zealand's geographic isolation, for New Zealand's economy, and for New Zealand's people. And so that means that our approach might be different to others, but we stand by that.
We're halfway through the lockdown. I'm just wondering, has it actually changed your life very much? Is there anything you're looking forward to doing once the lockdown rises?
And I'll spend a bit of time tomorrow reflecting on the halfway mark, but not really in a personal way at all. But to answer your question, I did get asked this morning. I miss people. And so this is nothing against any of the fine people in this room, but I am in this job used to having a lot of contact with the public, and I miss people. Yeah.
Why is New Zealand not participating in the Sentinel trial? This is the solidarity trial around testing and trials for clinical treatment of COVID-19?
Look, I don't know the answer to that specifically, but what I can tell you, and what's the date today, the 8th, I can tell you that there is our own Health Research Council has canvassed proposals, research proposals, including clinical trial proposals, and I know they are close to making a decision and announcement about what clinical trials New Zealand may be involved in.
WHO and the CDC and the kind of divide on face masks, is it fair to say that New Zealand's basically just taken the WHO's side on that debate?
On face masks?
On face masks. No, I think we've had consistent advice throughout, and what we've seen is that the WHO advice at the moment is consistent with the approach we've taken, and we keep it under active consideration.
Yeah. The 40 million masks that were ordered last week, have they arrived yet and have they been distributed?
They are arriving, so they are coming in batches.
And then the ventilators, is there an update on that?
Not at this stage, but as soon as we have confirmation of the dates that any additional ventilators will arrive, then we'll let you know.
Okay, I'll just take a couple more. Yeah.
So will any extra efforts be taken over the Easter break to enforce the lockdown, particularly in those sort of typical holiday hotspots?
Yes, you'll be hearing more from the Commissioner of Police, Andrew Costa, on this issue. We are aware that some may be contemplating leaving their homes and travelling to, for instance, holiday homes. And we've given the clear advice that nothing changes because it's Easter. The rules remain the same, and the police will be enforcing that. So they will be looking to be in the vicinity or at the access point to holiday hotspots to police that.
Derek. Do you have any update on when the surveillance testing might start? I know there's been a lot of...
What I can say is that the surveillance testing will be used as part of a broader range of surveillance measures, and it may not be now, it may be that it is used as we go into levels 3 and hopefully on to level 2, because that is when it will give us the most additional information. But the first point we might use it is if we don't feel there has been enough testing done in a particular region or a particular population, and we will know that over coming days once we have a better analysis and as the testing numbers keep growing. Remembering that we have now done a large number of tests. Our testing rate is good compared with other countries, and we're continuing to grow that laboratory testing capacity so that we can use it to really support our efforts to remain in lower levels of